Feeling overwhelmed by nursing school? I've been there. I survived and you can too. Keep on watching to find out. Hi, my name is Tayla and I'm a recent graduate of the Bachelor of Nursing from UTS, and here is my tips that I used in my nursing school journey, and keep on watching so you can be a better nurse. The number one important thing is time management. Especially nursing, you're going to be having like 6 to 7 patients wanting things from you. Anything can happen within those moments. Like you could have a clinical review, you could have a patient had a fall. If you don't have a plan, you kind of be like lost on time. You'd be like, what am I going to do this hour? The way how I achieved time management, I used a shift planner for my placement. So as a student, I grabbed one, wrote down when I did OBS, when the meds for my patients were. I'm a routine person. I rock up to my shift and I do OBS, I do pressure area care, and then I ask if they need anything. That's like my routine. Learn to think critically, because this is the most important part in the whole nursing life, especially if you're like starting out. Learn to ask why, because if you don't know something because you didn't know why, it's gonna bite you in the bum. Especially if you're looking after patients, you need to know why they're on that medication, why they're getting a specific treatment and not any other treatment. Knowing why a treatment or why we're doing an intervention, because it helps us better understand what we're doing and what we could be doing. I would say the most thing that helped me, I was practicing clinical scenarios. In the textbooks, I would use like the multiple choice questions from it and just practice that, and that got me naturally asking why. Another thing is practice empathy. Empathy is really important, because when you're with patients, they're coming in at their worst point in life, the worst possible pain they've been in. So you have to treat them like this is the most important thing you're doing for them. Not just because you have 4 other patients. Not just because you're just helping out the staff. Do this, you are wanting to these people get back to their lives so they were. And people are coming in and like they were fully independent and now they're bedbound because of an infection. Next tip is build strong study habits. So what I did, I used to like write everything down. What worked for me was memorization and like writing it multiple times. That's what worked for me. I can't say that it would work for you, because there's so many different ways to study, and whatever works for you would work for you. But I know there's other ways, like teaching someone else. That worked with other people with me, and I love that. Another tip is be confident in clinicals. These nurses around you are going to be like providing feedback to your facilitator, and they want you to succeed. And also your facilitator will be like, hey, you need to improve on this, hey, you're doing really well in this. But fundamentally, you need to be confident, because if you don't back yourself in your decision, you will kind of fall back on it and it would hit you in the arm, and that's not really good. Another tip is prioritize self-care. Self-care is the most important thing out there, not just to not get burnt out, but to help you have a better shift and when you can leave work at work. I mean, when you come home, you're not thinking about, oh, I forgot to do this, oh, I forgot to do that. It's more like you come home and you just relax, like watch TV, go to sleep, do whatever you want to do, but make sure you got the self-care down pat, because when you're in placement, you're not going to have that time to like cry in the corner. I definitely cried a lot during placements. Not because it was hard, just because it was tiring, and I was doing it for like 8 hours a day for 6 weeks. Another tip is understanding medication. It's very generic in 2nd year and 3rd year that you're going to be giving medications. Depending on what uni you go to, it might be different. I'm just speaking from UTS. Know your medications, know the side effects, know what it does. These notes are very critical to patients, because if you don't know a med and you're giving it and they go, what's this meant for? Like, I haven't seen this one before. You have to give the answer, be like, hey, this is just your vitamin D because your bones are really fragile at this moment because you recently had a fall. Like, you need that kind of interaction to know that. Thank you guys so much for watching, and I hope this helped you in your nursing journey wherever you are. Don't forget to be brave, be smile as a nurse, because a smile doesn't hurt anyone. It actually helps people, and just show that your care is the most important tool in nursing. And definitely use that to your ability, and I hope you all the best in your nursing journeys wherever you are. I'll chat to you guys next time. Bye.